Okay, good evening, everyone. I think we have seen quite a bit of very varied, interesting projects and stories so far. I would say that mine won't be that interesting, but actually it will somewhere fall in line with something what you had said very early when you this program started. We said that that's the journey of an idea of examine, express, and excel. We will see how an idea have actually gone through these phases. I won't say that we have completely excelled in what we are doing, but I completely believe that we are somewhere over there. So we are into business of saving some, I would say, premature deaths, trying to save people from dying earlier, basically delaying their deaths, and we'll see how we are going to do it. This is just a symbol of crude mortality rate. As you can see that in Africa, except Africa, I would say the numbers are not very high. In Africa, because of various reasons, the numbers are very high. But if I want to go a level deeper about how and where these deaths are happening, then what we see is 2/3 of all these deaths are happening actually because of what is something called chronic diseases. Chronic diseases are something which also known as non-communicable diseases, which is people will be suffering once they get it. People will be suffering for it for almost their entire lifetime. Okay. Now 2/3 of all the deaths today are happening because of this. Now, if I see that what is the total cost of chronic disease, if you see that apart from dying prematurely, apart from dying say few years before what I would say actually die, the quality of life deteriorates a lot. People may lose their food, people may have a stroke. What that effectively means is that even if they are alive, still they can't work. Still, their family has a huge financial burden. So effectively, the total cost of so-called chronic disease is actually much higher than just the death, much higher than just a father not able to see his daughter getting married, or a mother not able to see her grandson. Okay, just to put you in numbers, it's approximately all like 4 to 6% of GDP. We'll see some of those numbers as you go along. Yeah. So why? So many people are dying because of this, and why we have not been able to solve it. I mean, is it because the medication is not available? If you see, just for example, diabetes, the first insulin, which is the most important part to solve the problem of diabetes, was actually discovered in 1921. The most used medicine, metformin, was actually first marketed in US in 1992. So the medicines are available. If the same, I would say the hypertension, again, if you see at least for last 20 to 30 years, the medicines are available, then still why people are dying because of these diseases. And this is again another number that how the effect, the impact, the ratio of people dying because of chronic disease is increasing. Now with this problem, while we were trying to solve it, we also came across another very interesting data which said that, say for example, in 2005 around 53 million people died. Out of that, 2/3 of all the people deaths were because of chronic disease. But what's most important is 14 million premature deaths. 14 million premature deaths can actually be saved by a very simple intervention, what we call as if we are able to manage blood pressure and blood sugar, you can actually prevent so many premature deaths. Now with this as a challenge, and we started into this journey of, I would say, examine, express, excel. Now, yeah, I was very much, I would say, like many of you guys, I graduated from mechanical engineering, and after that I was working in a supply chain consulting firm where I was trying to help large companies design better processes, better business systems so as to improve their efficiency, so that they can meet their business goals. Now, many a times when we just assume that since they are such a huge companies, most of the things would be lying there, would be in the best possible way. And that's one assumption which after a lot of experience and confidence can say that we should never make that assumption. Okay, there are always a scope of improvement and we should try to find it. Now, when and the closest I was to a healthcare was that my dad is a doctor with his own hospital, and every time when I'll come back to home on a vacation or something, I'll tell my dad, hey, why don't you change this, why don't you change that, and until one day my dad said that, son, I am a doctor, let me do my job, you seem to be a manager, why don't you do it, all the suggestions which you are doing. And that day actually that made me think that if the doctors would always be in a lot of shortage. So there are some parts which has to be done by people who are, say, not fully qualified or not as qualified as doctors. And that made me get more interested into healthcare, and for that I went to ISB to study healthcare management. And that's where we while I was working with multiple ideas, especially focusing on the richer people who are how to solve the problem of chronic disease for them, we came across the Hult Prize, and that the challenge was exactly the same, but just that they said that, okay, please find the solution to solve the problem for the most bottom of pyramid, for the people who can earn like less than $2 a day, and that made the challenge a lot more difficult to solve. But we presented this. Okay, yeah, we presented this idea through multiple stages, and I'm sure many of you guys know this, all these stages. And we were finally we got through. Out of 11,000 teams, we were like the top 6 teams to reach the finals. And that was the first time an Indian team has actually reached that far, and we were, I would say, lucky enough to reach the finals as well. So, so that's where in 2014 we got an idea, I would say the first stamp of approval that, okay, this idea seems to be, has a good potential of making a difference into lots of lives. And after that, when what was the reason why the judges said that, okay, this is seems like a great idea which can make an impact, right? So we got deeper into that, why this problem exists, and we've said that, okay, as a disease grows, it is asymptomatic. The people have no clue that it's actually happening. Before and even after that, there are some symptoms. They go to a doctor. It's not easy to find a doctor or a good doctor all the time. And even if they are lucky enough to find a good doctor, it's not. These medications are required to be eaten continuously for their entire life, and that's again, is not easy. And that's the human behavior doesn't allow us to just keep repeatedly do the same thing again and again with the same efficiency, right? So effectively, what we found is that there are actually 3 problems, okay, within the whole problem of solving the problem of chronic diseases. The first one is the underdiagnosis, where the people just don't know that there is a disease that they are suffering. The second one is poor treatment, where finding the right doctor with the right treatment is not easy. And the third one is poor compliance, where continuously taking the right medication, making sure that they are doing a good job at it is not easy. Now, we also knew that we have to find a solution for all of them together. I mean, if you find just solution for one of them, that's not going to be enough. For example, if you just tell a person that, hey, you have a high risk for, say, diabetes, most of the times they will not go to a doctor. Even if the doctor says that, hey, you are diabetic and this is the medication you have to take, they will take for a month or 2, and after that they will drop out again. So we had to find a solution for all 3. Without that, we knew that the solution is not going to be effective. Now, with that in mind, what we found was that what if, we create, we start screening people. We're just telling them that, okay, who is at high risk, who is at low risk. We take them to the doctor, that, okay, hey, this doctor, please check. And only when the doctor confirms, we again go back again and again to that person that, okay, how are you doing and with your disease, whether you are taking a medication or not. And we found that technology is the key of why this can be done. Otherwise, when you're talking about, say, 100 people, this can be managed, but when you're talking about hundreds of thousands and a million people, you can't do it without technology. And I think the era in which we are living right now, the technology has developed, has become a lot more cost effective, that it is possible to do at the least cost possible. Yeah. Now, the whole solution is based on two key pillars. The first one, what we call as Sathi, which means friend, which is like a women health worker whom we train. And the second one is what we call as doc in a bag. Yeah. Second one is what we call as a doc in a bag, which is a device to basically we started looking to what are the bare minimum things which is required to be measured before we can tell a person who is at high risk or not. And that's where, with the existing device, we assimilated them. We said that, okay, if we can just measure these bare minimum things, we can actually tell people with a lot of confidence that, okay, this person is at high risk or not. And that's where we came up with this idea of doc in a bag, and we are continuously trying to see how we can add at first more diagnostic tests to it, and how can we make it more and more effective. Now with that, our journey began, and that's where we started, I would say, expressing our idea. And we started with the screening camps. This is just one picture. Then we said that, okay, we had three key areas where we wanted to improve. The first one is, of course, the scalability. That we knew that, okay, the medical solution for this problems has been existing for last 30 to 40 years. So we are not going to do any new innovation there. But only if we are able to bring this solution to millions of people, that's the difference which we can make. So scalability was within our solution from day one. Now the second was we wanted to make sure that our solution is effective. It's actually going ahead and making the difference in the people's life, right? So we started with hiring of Sathis, about training. When we learned that, okay, the one time if you give a training, that's not enough. There has to be a process of continuous training, and just to identify that when is the right time to give that continuous training is an innovation in itself, which we learned, I would say, learned from experience. And again, say the salaries, again, all these are things, a lot of things which we have learned from the experience by being on the ground. We knew that, okay, we have to give our Sathis, our paramedics, the incentives, but what incentives, how much, when? I mean, these are all the questions which actually requires a lot of thinking and on the ground feedback. Now we started actually from the manual entry of all the patient details. Then we moved to Excel. Then we moved to the Google Drive. I mean, this is again the journey which I'm trying to show you. Till now we have moved to tablets and the real-time sync up with the server, where we can actually see that how many patients has been screened today, how many patients are high risk, low risk. The real-time information is available. Now, where we are right now, we have screened more than 29,000 people, I mean close to 30,000, and it's again it changes real time. What we also found was, like, out of the total numbers, 45% of the people who we screened who were at high risk had no prior information that there was something wrong with them. So you can imagine that if we go ahead and screen 100 people, then 40 out of them we found them to be at a high risk. Out of that, approximately 18 had no clue that there was something wrong with them. And that's the impact which we are talking about. That's the number of people we are saving, we are identifying and telling them, please go to the doctor, so that they can actually save themselves from dying early or having a better life. Now, there are a lot of other information also it comes like, okay, how many people have diabetes, how many have hypertension, how many have both of them. Then there are a lot of studies done between the comorbidity between, say, these two diseases, which like, okay, if one person has diabetes, then what are the chances of them having hypertension as well. Now, this, the data, the amount of data which we are collecting very well shows that how much comorbidity actually exists, right? Now, what was the impact? So we showed that actually within a period of 6 months, we reached out to more than 30,000 people. Now, we also showed that saw that this is data of blood sugar level of one of our patients whom we are managing, and she knew that she has diabetes for last 5 to 6 years, and she knew that she has not been able to bring down her sugar level. Now, green is the level where it shows that, okay, which is acceptable level of sugar in a normal healthy being, and it very clearly shows, from June, since we have started monitoring it, how we have actually been able to bring her sugar levels down to acceptable or a good level. Now, I am not saying that, okay, this is data of just one patient, but our goal will be achieved when we can do, I would say, 80% of all the people who we are managing. What I am pretty confident about is that at least at this point of time, I know who is managing it, who is not able to manage it, and we can give them the right direction, the right counseling to ensure that they can actually go ahead and manage it. And I believe this is the first, I know for sure that this is the first intervention of this kind working for the bottom of the pyramid, and there is nothing which stops from taking it to the next level or to the middle segment or the higher segment as well. So we are focusing a lot on the technology right now, where all you guys and what the previous speakers also talked about, that how can we actually merge the learning from the ground and the technology to create an actual solution. And I would say definitely we have not excelled, but we are definitely on the path of that excellence. I don't call it the innovation in the science of disease, but this is definitely an innovation in terms of excellence, in terms of execution, making sure that what is required to be done on the ground is happening with not 1 or 5 paramedics, but hundreds of paramedics, and that's where technology has been a boon to us. So yeah, please, all continue to support us in making sure that we can save a lot more premature death. Thank you so much.